If you can imagine little holes kind of within the bone structure, within all your bones, that's what we call osteoporosis. So the word osteo really meaning bone, and porosis meaning there's little pores or little holes within the bone. My name is Dr. Cheng Ron at the Texas Center for Lifestyle Medicine. Today I want to talk about bone density screening or osteoporosis screening. And so talk about who should be getting it and what it really is. But let's talk about the disease of osteoporosis in the first place. Osteoporosis is when there is an imbalance in the body. So you have these cells that chomp away at bone, and you have these other cells that build bone. So the ones that chomp away are called osteoclasts, and the one that build bone are called osteoblasts. So a bone, believe it or not, is actually a very living and very active um, uh, part of the body. And so your body's constantly building bone and constantly taking bone away because it's remodeling, meaning that the bone is living, it's always replacing, always taking away damaged parts. So when there's more chomping away by the osteoclast than there is building by the osteoblast, that's where the holes can get sizable and numerous, and bone fractures can occur from that. And there's many complex reasons on why this happens. There's nutrition, there's activity, there is autoimmune conditions, and there are environmental toxins that can contribute to it. There's smoking, for example, is one of the major environmental toxins. And so all these different things can affect whether or not you build bone less than you break bone down, which can cause that osteoporosis. And before you get to osteoporosis, there's another stage before that called osteopenia. So osteo means bone, and penia means the decreasing of. And so osteopenia is before osteoporosis, and we treat it quite differently as well. And so, who really should be getting bone density testing? So, for those with no history of osteoporotic fractures, it's women ages 65 and older. That's really in the general population. And women ages 60 to 65 with an increased osteoporotic fracture risk, which is determined by risk scores, can actually be screened as well. And there's some people that actually be screened even earlier than that. And so, according to the United States Preventive Task Force, those people who also have fractures that are non major trauma fractures can also get osteoporosis screening earlier on. And so there's a bit of a difference between the different national bodies and guidelines, but a majority do agree with this general recommendation. There are risk scores that your doctor can help you calculate called FRAX scores, FRAX, which calculate a 10-year risk of major osteoporotic fractures. And those help us determine what to do in terms of screening and also what to do in terms of if we find osteoporosis, what do we do about that as well. In general, women tend to get more osteoporosis than men, but in general, but men can certainly get osteoporosis as well. And so, bone fractures and osteoporosis are one of the most preventable chronic diseases that we know of. And this is something we want to capture earlier on. So, what do we use to screen? So, there's different types of screening tools. The most commonly talked about is the DEXA scan. And so these are bone density scans, and they measure the bone density at specific areas. For example, the hip, the lumbar spine, and depending on the machine, there's actually other smaller areas that they can actually look for as well. But the one that's most associated with larger fractures, hip fractures, of course, is looking at the density of the hip. That's a big one for us to really understand and see. And so, um, the process of getting a bone density scan is pretty easy. Your clinician can order it. We generally order it to a site that does these DEXA scans, and once you're scheduled, you get it done. A report comes back to your physician, and it's something that we can deliver to you as well. And so the importance of this is really understated. And from a clinician who's been in rounding and hospitals as well as nursing homes and assisted livings and stuff like that, what I generally see is that bone fractures are a huge mortality risk, which means that if someone falls and there's a fracture, there's things that surround the fracture that can increase the chance of people dying. What are those? Depression, inability to eat, being on pain medicines that erode away at bone even more, being on other medications that decreases the quality of life, and it increases the breakdown of lean body mass, which contributes to other bigger things as well. So, very passionate about getting our patients to get screened for bone density, and treating it early and getting it tackled early is such an important thing. And so, in terms of what type of machine to screen for what type of people, there's no recommendations for that. But in general, it really is the DEXA scan that we order. And I hope that answers your questions about the osteoporosis screening. Thank you.